Hope all had a very good lunch and that there's no postprandial fatigue setting in because we have a very exciting afternoon. Our first afternoon session will be moderated by Susan Fisher-Owens. Dr. Owens is a clinical professor of pediatrics at UCSF School of Medicine. We seem to have a good foundation with UCSF here today. And associate clinical professor of preventive and restorative dental sciences in the UCSF School of Dentistry. She does serve as an executive committee member on the American Academy of Pediatrics Committee on Oral Health, as well as on the California State Oral Health Plan and the California Perinatal and Infant Oral Health Quality Advisory Board. She does practice also at the Zuckerberg San Francisco General, the county public hospital, and did create an award-winning and sustainable oral health clinic embedded in their pediatric outpatient clinic. Dr. Fisher-Owens works with physicians on how to prevent oral disease in children or control it in adults, particularly in pregnant women, and as we've heard already this morning, how important that is, and with dentists on how to work with children and incorporate context of care. Her research on a conceptual model of children's oral health has been cited internationally, and our current research focuses on children's oral health disparities. So Dr. Fisher-Owens, it is all yours, and thank you very much for your attendance.
Thank you very much as well. And I am thrilled to be here, and there's no way you can fall asleep because we have an incredibly exciting panel to start with this afternoon. So thank you for my introduction, and thank you all for being here, and most of all for the Academy for sponsoring this time. So this afternoon's workshop will be on looking at pathways for integrating oral health into systemic health, and hopefully vice versa as well. Because our speakers are so phenomenal, I'm actually going to truncate my introductions so you can hear from them instead of hearing about them. But you have a lovely and incredibly impressive biography in your packet if you'd like to read them all. Our first speaker will be Dr. Renee Joskow. She is the Chief Dental Officer for HRSA. And so we're getting a great impression from her about patterns of how we can do the integration. Second, we'll hear from Dr. Amit Acharya, who is a clinician who caught the integration bug. And I say this is the way we should do it. I caught it too, and we want to spread this infection throughout our colleagues so that we can work together. It's a positive epidemiology. Third, we're going to hear from Dr. Snyder. Dr. John Snyder is the Chief Dental Director and CEO at Permanente Dental in Northwest. And then last but not least, we're going to hear right from the ground from Kelly Close, who is a public health dental hygienist working and running the program Into the Mouths of Babes, which you may have heard earlier this morning being referred to as IMB. So the infamous IMB we'll now hear more details about. And then also hopefully we'll be able to get her to talk a little bit about her role as a community dental health coordinator. Did I get that right? CDHC, which is one of the emerging fields as a way to look at finding more integration of oral health into our communities. So as I promised, an exciting bunch. Let's get started. Thank you. Similarly to the other sessions, we'll take questions at the end.